and then also doing work into the nervous system where you're doing more direct, like work on nerves and finding where the nerves actually entrapped. So looking at the body as a whole and seeing, like, it was quite a cool moment where I had just finished this course on the nervous system, and I had this big aha moment where it was like nothing made sense from what I'd learned, and it was like this new world had opened up with how the nervous system really does work. Because in physio, or how I was taught physio, it's very much like segmented into, okay, so, you know, the arm, the nerves come here, you've got the brachial plexus, and then it just ends here, and then that's it. That's the nervous system that supplies the arm. But this new way that I started to learn was how interconnected the whole nervous system is with the whole body. So, you know, like finding that a foot was causing an arm problem in the nerves, and seeing how the nervous system had such a big impact. So how I'm going to bring it back to tennis elbow is that most of the time, so when you see tennis elbow, you often get that, you know, the pain with the lifting, squeezing, and they complain it's very much that lateral epicondyle tenderness. So if you touch that position, you know, it's painful. It can be red, it can be swollen. Sometimes if they've really pushed it. So most of the time it presents as like it's tennis elbows that they've overused something. They've, you know, tennis is a big one that they go, played a couple of rounds of tennis, I did something more than what I normally do, and now I'm suffering. And it's one of those funny injuries where it can last for up to a year, so which doesn't seem to make sense for most injuries. You know, like if you've just overused something, shouldn't that just recover after you know, like have that rest time? But the reason it doesn't recover, I found, is because the nerve is restricted. And so you often see, so if you push on the muscle, you'll get that like really tough resistance, that muscle that never wants to give, so you could be there massaging it forever and you'll feel like it just never really responds. When normally if you were massaging a muscle, it should give within 20 seconds, otherwise you're in the wrong spot. So if you're finding that you're on a muscle and it's just not giving, it's a nerve tension and you're on the wrong spot, you'll never release it. So you need to get to the nerve. So that's the tough part that we were discussing. It's like, how do you get to the nerve? Because, like I say, the nerve tension can be coming from anywhere in the body. So in practice, so you can get people that's often, like they say, the majority of people take 6 weeks to recover. But when you can find where it begins, I can get people come in, have quite severe pain and deficits in strength in that session, in the testing. So you test them with the squeeze and the lift and our pain, you push here, our pain. And then if you can get the right spot to release, so if you can actually go on and release the nervous system where it needs to be released, then you can retest, no pain in touching, the muscles completely relaxed. So within one session they can be pain-free out of the door. So and that is quite an exciting thing when you can really understand the nervous system and as it works as a whole.
So the course that you did inspired the ideas, or this is the way that they teach it?
It is the way that they teach it, but it also, like, it was like, then I've got to add on to it because of the other courses that I've done that really start to bring in how the body works as a whole. And so when you start to unravel that and see how everything is interconnected, then you start to figure out things for yourself as well.
And so we talked briefly before about it's not so much scarred, it's the term again wasn't compressed.
Nerve entrapment.
Entrapped.
Yeah.
And so what's your we talked a bit about how that works, or why you think that's why entrapment might be a problem.
I find that nerves can be agitated for various reasons. So you can get nerves that are entrapped because of scars. So appendix scars are a big one.
Go on.
And I often see appendix and tennis elbow. So cesareans, any kind of like surgical scars on the abdomen can create a restriction where it entraps a nerve. So if you imagine like a nerves are like one long string, and everything's connected from the top to the bottom. So if you entrap something somewhere in the body in the nerve, then the nerve doesn't like that and it gets agitated. So what happens is your body wants to actually hug that area. So it will try and go, okay, so if there's a restriction here, coming in and done the appendix, but it's held onto a nerve, then your body goes, oh, I'm going to hug that. And so what happens is there's this whole body shift down and it compresses then, so like the neck on the right hand side, and that neck on the right hand side then may compress the nerve that goes to the arm, and then that creates the tennis elbow.
And so we sort of talked a little bit, we talked about why the nerve compression created the tennis elbow.
Yeah, so that's because of that string theory. So so if your body's trying to hug from here, then it's going to pull from another point. So it has to take. So if it's, like a string's a certain length, if it's trying to create more here, then it has to take from here. So what happens is it's actually taking from here. So then you end up getting the nerve overreacting and sending too many messages to a muscle through the forearm. So then the forearm starts to get tight because it's overstimulated. So then the muscle is overstimulated and giving too many muscles, and that's why the muscle's tight. So then we try to, if we try to massage it, we'll get nowhere.
Keep stimulating it?
Yeah, you keep stimulating. If you try to do nerve flossing, you keep stimulating it and you actually make it worse. It's like, you're stretching a nerve that's already stretched. Why would you stretch a nerve that's already agitated and stretched? Like when you start to see it, it doesn't make sense. You've got to actually try to get the nerve to relax and release where it's
trapped.
Yeah, it's trapped. And so lots of different reasons. It could be an infection. It could be, and then it's entrapped a nerve around it. It could be that there's an old injury that had impact where the body's trying to rotate around it. Or it could be an injection, or so I said that with epidurals, or surgery, or something usually foreign that's
stimulates the nerve. Yep. And so once you've identified where the entrapment is, how do you? I'm probably jumping too far ahead now. How do you manage the entrapped nerve at the different site, at the alternate site?
Yeah, so there's certain skills within that course that I did that can actually be quite detailed into accessing the nerve and releasing that nerve, and that's very gentle, delicate work. So it's like actually feeling the little nerve and then releasing it. It's quite
very light.
Yeah.
Not like traditional
heavy
muscle massage.
No.
Yep.
But say if it's around a scar, then you might be thinking about letting the fascia and all the tissue around that scar to go, and then often the body can glide properly. So if you're thinking about a nerve that's entrapped in a scar around it, it might be like that it's compressing so the nerve can't move through the channel properly, so then it's just stuck in that. So it's like opening that space for the nerve to then elongate. So it depends really
what the cause of the entrapment is.
Yeah, exactly. But other things that you can see as a result, so it's often you get the tension in the muscle. You might find that you get a restriction in the wrist, so whether it be a flexion or extension, that there might be a restriction where you see maybe they only get 50%. And if you were trying to go, well, is that the nervous system? And if you had a clue where the nerve might be trapped, you can hold pressure there and see if it improves the wrist, and it will improve it immediately. You can also get deviation of the wrist, so it might be an ulnar deviation. So if you imagine that, I was saying to Sarah before, that I actually have a restriction that creates tension in my forearm, and so you can feel the tension in the muscle on that right side, and it also creates an ulnar deviation of my wrist. So my wrist is wanting to always do this. Now, if I do an hour-long kayak, and if I haven't been kayaking for a while, then I will get tennis elbow and decurvens like symptoms. And that's, you can imagine, like, if my wrist is stuck here, it's like in this constant level of ulnar deviation, and that's going to strain through those tendons and also up to that muscle. So that's going to be always on stretch and always pulling. That ulnar deviation is from a restriction in my left foot. So if I correct my left foot, then the ulnar deviation goes away. So unfortunately, I can't correct that permanently because it's from a bad surgery. But hopefully that's going to change in the next few months. But yeah, so that's why this would be chronic until I addressed that. But yeah, it's knowing how to relate the whole body and try to figure out, like, unfortunately, they teach you more within, like the traditional physio, and if you look up anything to do with tennis elbow, it says stretching, massage, exercising, and nerve stretching as the thing to treat it. But I wouldn't be surprised if that's why it lasts so long. They might just help it along a little bit, but that's why you don't get the result potentially as what you would expect to get. Because
that's
more,
pretty
it's
extreme.
complex than just overuse or agitation of tendon at that point.
Term overuse. But chronic activity syndrome. So anyway, okay. So we've talked about tennis elbow, and that's good. We've talked about the chronicity of it. I guess there's probably an opportunity to talk about the traditional method. So you've talked about traditionally, or the typical method is to stretch the muscle and to stretch the nerve.
Yeah, there's nerve flossing, or thinking about like how the shoulder complex relates. And I mean, they can be good things, but again, if it's a nerve relating to the tennis elbow, then those things probably won't have.
Do you do multimodality, or do you try and stick to the nerve entrapment practice, or do you
Whatever the body needs, really.
Yeah, at the time. Yeah, so you're assessing all the time. Yeah. And that is tactile.
Yeah, hands-on.
Yeah, that's what I thought. And then, so what other modalities do you lean on?
Acupuncture.
Go on. And does that relate to the nerves, or is that different?
Yeah, so...
I know I'm asking a stupid question.
I find acupuncture much more effective than dry needling, because dry needling can sometimes just dump the nerve system
what
again.
the difference is.
So acupuncture works on meridians, which is like there's, you have points of low resistance in the body where there are points of where there's a lot of nerves and blood vessels and so forth around that area. So they've all been tracked over thousands of years. And so when you put a needle into that point, it activates a certain response of the area that increases blood or chi, and chi being like energy to that area, so that it can have more energy to heal. So that goes actually quite well with tennis elbow.
And dry needling
is, it's like, I relate it to taking a computer, and if it's like spasm, if the computer's not doing so well, then you turn it off and on.
Yes, okay.
And so dry needling is like a way that you can get a quick response from a muscle to get it to spasm and let go.
Okay. All right.
So you're going into the middle of the muscle belly and elicting a neural response or a muscle response.
Reflexive contraction.
Yeah. So that it contracts and stuff. Whereas acupuncture actually more works on the whole, so you can spark through the body and like there's certain points that you would use in the body for swelling or for like working on that whole line.
But they're not necessarily in the location of the swelling. Yeah.
So this is the large intestine line. So that comes into around tennis elbow, which is quite interesting because quite often if they've had an appendix and it restricts around the cecum, which is around the large intestine, and I release that, it will release that acupuncture line.
Yeah.
So.
Yep. And so when you do acupuncture for tennis elbow, what do you do? What are your objectives? What are you trying to achieve? Sorry, how do you achieve your objectives? There you go.
Well, it's usually based on I'm first of all looking for where I find the nerve to be restricted, so I'm trying to address that first.
Yep.
And then for acupuncture, it would be like to try to bring normality to the area, so maybe more blood flow, trying to decrease swelling, trying to increase the recovery time also. So I've looked at where in the body the nerve is entrapped or what needs to happen for the body to be able to recover this. And then once I found that and released that, and that's in a better position and it can move forward, then I use acupuncture as the way to then speed up the recovery of whatever damage is actually resulted to that physical structure.
Area. Yep.
Does that make sense?
Yep, I've got that. And what else do you do?
What else do I do?
You're talking about using small manipulations. Is that similar to like emetherapy?
No.
No?
It's called neural manipulation through the Barrel Institute. So it's like you're actually going onto the little nerve itself, and so the nervous system does this constant movement, and so you can actually feel that, and then you're holding the nerve to where you feel it's entrapped, and then you're trying to move it through the canal that's entrapped in, or you're opening space. So like say if at the femoral nerve there's an entrapment, but it's because the inguinal ligament's restricted, maybe they've had a hernia repair or something, so you're trying to like lift up the inguinal ligament so that the femoral nerve can then flow again. Because that will affect. And then you can get, so if they've had bilateral tennis elbow, so it's affecting both sides, or a single side, then you might be considering is it originating in a peripheral nervous system or the central nervous system. So you might, if it's both sides, you might be considering that there's something going on from the skull down towards the sacrum. So somewhere along that central system is agitated, so you'll be looking more.
You talked about that before, and you talked about how that treating the central part of the nervous system is effective. We talked about that before, didn't we?
Yeah.
That's right. Okay, so retractable tennis elbow. So you nerve entrapment, acupuncture. What else do you do?
That's a hard one to explain. But the most part of it's so finding where something's stuck and releasing that. So I also do visceral manipulation, which is work directly on organs. So say if there's with the cecum from the appendix scar, then I can work directly on the large intestine, trying to release the scar tissue or the restriction of the organ itself. So then it's like opening up for the tissue to be normalised and the body to stop hugging
the side.
The restriction is. So then when it stops hugging, then things will normalise.
Does it usually take a couple of sessions of that for it to work?
No, it can be instantaneous. So that's the thing. It's like, so I had a guy the other day, he came in, I often don't see too many acute things, but he came in, he had tennis elbow on the side, and quite a lot of pain with any squeeze test and extension, and it's quite tender locally to the point. and it ended up that he had a scar when he was like 20. He was in his 30s or something. He had a scar along his leg that was entrapping a nerve. And so when I released that scar, there was no more pain and complete ease through his forearm. So
Can the
and
nerve
then,
become
yeah,
trapped
yeah.
again in the same scar?
yeah, it can. It's like teaching them how to release the scar themselves as well, and then but generally, like if you do the nerve release well, then it's a permanent release. But with scar tissue, depending on how thick the scar tissue is and how deep it is, maybe they might do an extra sport or something, and then it might wind up. But it's teaching them the tools that if they do that and they start to get that, then they can just come straight down here.
Focus their attention on it.
Can I have some questions?
Yeah, I was going to say, we're nearly at half time, so I was going to say, can you please ask some questions now?
Sorry.
So,
No?
when I was
Can you just turn the air conditioner? I hate that air conditioner.
when I was a younger physiotherapist, and I went to watch a spinal surgeon do surgery,
Yeah.
and once he'd opened up the spine, cut
The spinous
the
process is off,
laminectomy,
done the
yeah.
laminectomy, very good. Yep.
and sure enough, this thing you referred to about the spinal cord and the pulsing, I could see it, and I thought it was absolutely
Oh,
bizarre.
wow.
What is that?
Why is it
Yeah.
pulsating?
Yeah, what is it?
You do.
Part of that is from, you need to replenish the brain with the fluid, so it's like the fluid that's
So
moving
it's like a circulation.
through, but your body's constantly going into, can't think of the name, but contraction, retraction all the
Yeah.
time, so the nerves are always just going into this contraction,
Because the
retraction.
spinal cord was moving maybe 1 or 2 mil.
Yeah,
It's
yeah.
like significant.
It's pretty
You know,
big.
it was
Yeah.
enough to see it. And then my second question on that topic to you, Sarah, is when you've got a patient in theatre and maybe some open surgery, do you see that in the peripheral?
Peripherally, I don't.
findings?
Well, the first thing I do is put it in a tourniquet.
Oh, so you're
You know, so
blocking-
so I must lock it all down anyway.
Yeah.
So it'd be hard to notice.
Yeah.
I thought you were going to ask me what do I see when I look at tennis elbow, but the answer is, it's pretty standard. If you've got a really rip-roaring, 12-month, completely neglected, never rested, just flogged it, you can see the concurrent sort of attempts at healing and the failed healing. So you can see the granulation tissue almost, so it's trying so hard. It's not quite granulation tissue, it's not quite a red. It's not red raw, it's like a pale pink. So you can see the granulation tissue, and then you can see it sort of ripping and failing at the same time. The tissue, instead of having fibres like actual strings, it's just like not like a really hard gel, like almost like a, can't even describe it. It's so tough, the gel, but it's not got any integrity. This is when
Is
they've
that the
had
tendon
it.
you're referring to, like a recitative tendon, or
Yes, it's the tendon. Yeah.
Mm.
So when you look at a tennis elbow tendon, they've completely destroyed it.
Yeah.
By the time they sort of, if they persist, obviously
they
what we're
get
trying
to
to
the
do is trying to catch them before they've persisted for that long. But they can really pull their tendon apart if they want to.
I guess on that note, evidence-based reviews on that tennis elbow, which would refer to
Where did you find them?
which would refer to your typical things you mentioned. I guess where do you if we see those things in the tendon? At what point do you accept that some cases may just genuinely be an overuse and treat them via regular tendon pathology?
But
Yeah,
the tendon
so then
wants
you're
to
looking
heal.
for-
The tendon
yeah.
wants to heal,
Yeah,
of
yeah,
course,
but
right?
in
So the
terms
tendon.
of-
So that's why
That's where I guess.
it's not. I
in
don't
terms
think
of
it gets
all
to a point where it
tendons.
has to be intractable, right?
I would say again, sorry.
I don't think it gets to a point where it can't heal.
No, I'm not saying that. I'm saying in terms of if we acknowledge that those changes happen in the
Yes.
tendon.
Yes.
I guess in that case, would you then focus more on your load management, your strengthening?
Yeah.
At that point,
So
I
there's
guess,
certain
why go away
cues.
from the local area if it's clearly, I had a
Mm.
chef the other day who had a tennis
Yeah,
elbow.
yeah,
It was
yeah.
just clear, he'd been off work, went back, and all the work holding the
It's hard
pins,
to
it was
get
very
into
clear,
charge,
he had aggravated, he overused, I won't use that word, he'd been doing a lot of wrist extension loaded after a period of doing none, and he just flared up. I guess in that case, why go away from treating like the tendon like you would a patella tendon off your Achilles tendon?
You can do, but I would look at clues as to if there is an underlying nervous system tension as well. And those clues would be like the muscle that feels bulky, thick as a whole, and then you might look for the restriction of the wrist, and other things that the nervous system might display, like it's that constant as well, like even when they're resting, you can get that constant. You don't need for the nervous system, a lot of people think, it's a nervous system involved only when you get to pins and needles or other things about a nervous system. So there's other things that the nervous system will display rather than getting there. But there can be definitely like just overuse, but like if we're thinking about the nerves being involved in tennis elbow, then it's kind of where I'm coming from, but you can get definitely just
what I'm trying to say is that the tendon will heal itself as long as you stop irritating.
Yeah, that's what I'm saying.
So you're saying that. So what we're saying is it's overuse, right? So we're saying it's activity related.
Yeah.
But then if it's actually an imbalance that's causing the overuse, then the overuse itself, it's not the amount of activity. It's the way the activity's done.
Yeah, so I guess most presentations I see are just, your typical when you ask them yes, I have not played tennis in 3 months, now I have. That's kind of the
From
shit
0 to maximum.
Yeah, but then it's
speed.
how did it handle it before, and why did you have a month off and now it doesn't handle it, it's like the
gradual exposure
general life
versus
but it's still
0 to 100.
It's hard to get them to do
doesn't
that.
Also I find that there's always an underlying that never completely runs itself. There seems to be always an underlying reason that got more exposed than what it needed to be, because the body's really adaptive and it generally can handle a lot. It's like, why does one person get an overuse injury and the other person doesn't? It's, they're doing the same thing. One person might have a month off and the other person also had a month off, and then one person ends up with tennis elbow, the other person doesn't. They did exactly the same thing. So then you're thinking, well, it's what's underlying that created the
I guess in that sense,
exposure,
I'll look
kind
at
of
more
like.
at, the other aspects of their life. Is one more doesn't sleep? Does one smoke? Does one?
There's a lot of variables.
Absolutely.
Strength of one versus the other.
Here we go.
I have a question. Bit of a beeline, but how does what you were talking about compare to reflexology?
What's reflexology for the medical people, doctors in the room?
I don't know what it is.
Okay, maybe I just found it.
Admin in the room.
No, I'm just you always walk past, the shops, and then it's in the massage place, and it's reflexology, and it's a whole they'll have a chart of the foot, and you push here for face, push here for liver, blah blah blah.
Okay, right. I see what you mean.
Is that similar to what you're doing? Is it completely different? This is just sham or?
No, it's not sham. I don't think the reflexology, what I'm doing is more very targeted, direct. So there's certain tools that you can utilize to find exactly where in the body that something originates from, and then we can be really precise onto the exact structure. It's hard to explain it. So the tools that I learned is giving you the ability to feel with your hand exactly what structure is misbehaving or restricted, and so being very precise on the location and the structure, and then releasing that at its core, and then when you do that, the results are pretty profound. So it's reflexology is kind of more of a, from what I understand, is just working on the foot and into certain parts of the meridian. So almost in the same way, maybe acupuncture, but less direct than acupuncture. So
Fair enough.
It's sort of like a mapping principle. So it's mapped,
Yeah.
and then what you're trying to describe for us is that you're trying to do something that's much more individual patient specific.
Yeah.
Whereas the acupuncture or reflexology, that might be more a map that's been generated over a long period of time.
Yeah. It's just it's not, yeah,
It's
from
like
the
using the
it's
same
not
thing
going
for
right
every
into
person.
the, to
Yeah,
that
yeah.
like
Whereas-
exact location and.
Yeah, what you're doing is different in that it's so specific.
Mm-hmm.
Okay.
So without sharing your secret sauce in terms of, you know, all the things you've learned, when you're assessing a tennis elbow, in the context of tennis elbow, not another injury, what subtle signs would you be looking, you know, to try and find that source, you know?
Okay, that's a challenging one to try to
Yes.
explain. in
I
a
try to keep it to a
very
small
short-
area to try and
Yeah, so for tennis elbow, so like for me, you know, we talked about that I get that tension. So mine comes from the foot. So then it's hard to explain. But if I correct my foot, then straight away my ulnar deviation disappears and that tension disappears. To try, it's hard and I can't really explain it in a very short time. But I would be just more looking to release the, you know, like feel in the whole body and feel where it's stuck in the spine and let the spine as well kind of direct you. So if it's like that you're feeling like the lumbar spine is shifted, then you might be thinking, well, who's it shifting to? Is the lumbar spine shifting towards the leg? And if you release the leg, does that improve the lumbar spine? And then how does that work up
Okay.
above?
So using
That's a big conversation.
using any sort of like
It's
neurodynamic
quite-
testing all throughout as
Yeah, but it's quite succinct. So it's like, you know, like you might test on something for, you know, like my assessment might take 10 to 15 minutes in the treatment, you know, 10 minutes being really precise on it. So
Yeah.
you do a really good assessment. But it's like the courses that I've done allow you to be very quick. And, you know, like it's not a really long like trial and error process. It's actually being able to really like target that quite quickly and find where it starts from, relate that back to, you know, is that going to help the area of concern, being like tennis elbow, and then treat that.
Yeah.
Does that help? Gone. Yeah. So.
And who runs the course that you?
Oh, so there's a number of courses that I've done, and I've just put them all together and
Oh,
also figured things out for myself. So when you start to train in a whole body approach, you start to see the body a little bit more, and you start to figure out things, how they work and integrate.
So where
So,
did you
yeah.
start this journey? So when?
It was when I was living in Canada, and I did a course called Discover Physio, and it was a year-long course that took you through.
It was for physios to discover physio.
Discover, yeah, it was, but it was like completely different. Like, I always felt doing in my physio degree, like I was like, nothing makes sense here. Like, I always asked why, and I was so curious, and it just like nothing seemed to make sense. Like, why is that? That's random. Like, how does that happen? And then I did this course, and I was like, oh, finally.
And so what was in the Discover Physio course?
Well, it's all about how to put the body together and how to figure out how things interconnect and how to find what we call the driver. Is like, where did it start from, and how does that then create the next problem? And like saying, you know, being quite definitive of like, yeah, okay, well, your Achilles pain is because your shoulder's out, and you know, it's got like some weird scar tissue, and or yeah, so it's been really definitive how things start, and then when you treat them from the core, then they disappear really quickly. And it's cool for the client, and it's also cool as a therapist because you really get to like delve into where things started, like understand how the body works as a whole, and clear it so that they aren't, you know, like, it's not probably good for business as a whole. So you don't get like huge repeats, but
Do people come back with different injuries?
yeah, they can do. Yeah, but usually it's in the same place.
So that's my next question. The entrapment is somewhere else.
Yeah, it could be from somewhere else, or depending on like the, you know, what's the cause of the entrapment. So like if it was like multiple surgeries or infection, then it could be a bit harder to figure out. So.
There's a course by Francine's coach, is an anatomist, and she does courses of physio, I think.
Okay.
And she does them as like dissections.
Oh, cool.
And she dissected the deep neck extensors to expose the dura at the bottom of the cranium, and then she'll flex the big toe, and you can see the dura moving. So it's she seems to be along that line, really.
Yeah, yeah.
A lot of focus on the neurological system.
Yeah.
I think I'm really, for a lot of physios, we've been drilled into through education means to have a focus on evidence-based practice. So we're naturally very sceptical of something now that is not evidence-based practice.
But is it not evidence-based because there's no evidence because it may not be
Correct. Yeah.
supported?
Because no one's really
Yes, I mean,
investigated it yet.
well,
Yeah.
through the neural manipulation, which runs on that same line, they've done a study through it, but
What would your
Yeah,
thoughts
it
be on? Sorry.
harder, with that, because it's-
Yeah, but it certainly makes sense. It's an interesting concept, and I think like if you could teach it, it's
that's the idea.
it carries merit for sure.
That's my idea. We'll watch out for the next couple of years.
Well, I was just going to say, I believe there is some studies that say like acupuncture, dry needling, and whatnot that show like sham versus, just pretending versus real to be no difference. What would your effect on those? Well, what would you thought? Have you seen
Placebo.
those?
Mm.
Yeah, like
Placebo study, that would be really hard to get used to. Well, no, you could do a placebo study.
oh, then they have done.
No, I'm just thinking with this technique,
Oh,
could she do a
with the-
placebo?
Yeah.
You could do a placebo trial. Does that make sense? Like,
Well, I definitely know if I haven't got the right spot, they don't improve.
no,
yeah.
but you could do sham release in order to give you your evidence base. Do you know what I mean?
Yeah, I know. Yeah.
Mm.
Yeah, it is a harder one to study though,
But I think what you're talking about is you get to a certain point in your career where you're just looking at something that just keeps coming back, like tennis elbow, they just keep walking through the door and you just know that what you're offering them isn't fixing every single person that you see, and having more things in your armamentarium is you never regret having more options.
Yeah, it's interesting. And in terms of, can we achieve the same things through exercise? In terms of, can we mobilise the neurological system with exercise?
Well, the nervous system, once it's agitated, doesn't like being more agitated.
Oh, okay, yeah.
So it can be this fine line. It's like getting it where it's happy to move, and then it's like this. The nervous system's agitated here, and then doing more exercise here is, do you want to make it potentially worse?
Yeah.
So that's a tough one, because it's overstretching and over-exercising the nervous system when it's really agitated will make it worse. But it's like finding how to release enough that it can calm down. So like doing dural stretches can help the nervous system. So
What's
there's
a
like
dural stretch?
coming into the base of the skull and coming up to the dura, and actually working the dura can help to calm the nervous system as a
So
whole.
manipulating the base of the skull, is that what you?
Not manipulating, but you actually come up through the up to feeling. You come up to the
The opposite way.
split, but then you actually, if you let your fingers travel through, then you can actually approach onto the dura,
Yep. Okay.
and then you can move that. Again, that's a concept that's not traditional physio either, but it, I've been taught it by a really.
No, we use reasonable techniques, right? If you instantly want to calm a patient,
Yeah, so it's hard when like trying to give you clues on how to then what can you do to release the nervous system, and it becomes quite challenging. But yes, when you don't, I can't teach what I know in this talk, but just time. But it's looking at the body as a whole and going, okay, well, what else is restricted? What can I release? Or like, is that calf really tight, or something's going on with the ankle? Maybe that's connected, and start to get a bit curious of like what else and where else could this tension be originating from? And that's, I guess, the biggest thing is be curious. Or what are yoga stretching? Like when you yoga stretch, it's like yoga is great because it actually works through the whole neural lines and fascial lines, so that you can also
What, rather than muscle?
individual muscle stretching.
Yeah.
So when you're doing yoga, it's like working the fascial lines as they connected from the bottom to the top.
Yes.
So you're
As opposed to individual muscle stretches that you do at the gym, sort of thing. Is that what you mean?
Yeah.
Mhm. Okay. That makes sense. So where are you going to take this? What are you going to do with all of this? Now you've got it all worked out.
Yeah, so I have currently shifted the business to a new location that I don't have to put so much energy into the business, and I'm working on a plan to bring all the things that I've learned over the 2 decades of Physio to teach something.
Good.
Haven't quite worked it out yet, but yeah, do something.
It's good to talk about it. I think it brings these things into fruition if you air them. I think sometimes it's hard to talk about them, but I think if you air them, sometimes they become more real.
Yeah.
And so you were talking. I asked you a bit before about what sort of cases you like to see, and you mentioned that you've got a bit of a waiting period, so that's fair. But I guess if GPs want to send you something, what type of patient are they looking for? When they see someone and they've got undifferentiated knee pain or undifferentiated elbow pain, how do you want to direct a GP?
It's like the person that feels like they've tried everything.
Oh yeah, yep, good. That's a good answer.
Yeah, so it's like, oh no, resigned myself to always going to have pain.
That's
I
good.
like those people.
Yep, good.
They provide a challenge, and like sometimes they don't always meet the challenge. That's normal.
That's the joys of being a
but
practitioner.
then I might be able to refer them to someone else that
Once you've got an
may
idea.
be able to meet that challenge. But it's I like the tough ones. And I also nervous system. I liked anything that's to do with the nervous system.
Do you mean like carpal tunnel nervous system, or do you mean
carpal
like
tunnel, anything
cervical osteophytic nerve root compression? Is that which one?
Not my. I prefer carpal tunnel or
Yes.
more peripheral things. So also say if you know that person has had a lot of scar tissue in the abdomen.
Visceral,
So and they've had a lot of ongoing problems, say with their back or shoulders. They're a good referral because so much. The guy that I learned through John Pierre Burrell, he says, and he was like the head of osteopathy in France, and he states that he thinks that in his experience and studies that 80% of all things that come into the clinic are visceral based. So they're origin from the viscera. So. And I wouldn't be too far off it.
Of what you see.
Yeah. So when you think about it, it's like, what does your body really prize? I mean, your body prizes everything, but it's like the things that keep you alive. It's blood, nerves, organs, eyes. So it's like those things, when you can work on those things and they have a powerful response to
Peripheral musculoskeletal system.
Yeah, which is sometimes a dumping ground.
Yep. Okay. That's probably a take-home word. Dumping ground for. And so what I heard was you spent some time in Canada, and now it sounds like you've spent some time in France, or was that
That's just
the course?
No, that's the founder of visceral manipulation.
Yes.
There, and so he runs courses throughout the world.
And so you've mentioned there's been more than one course. Is there any other courses that you feel like have contributed to your ideas?
Yeah, even down to Pilates instruction and real-time ultrasound and
Yes.
just understanding more of like how the body works within the deep core system. They all add something. They all add a layer. But yes, it's definitely the ones that are more about a whole systems, whole body approach that like.
But you found the most useful.
Yeah.
Mm.
Yeah.
I think
They're on a
there's
different level. Like it feels like.
those core.
Yeah, it feels like they're on a, like the anatomy and the level of understanding needs to be up here as opposed to like a lot of
Just
the
isolated.
basic physio.
Mhm.
Yeah. Yeah. So I really enjoy the whole systems.
I think there's a big pressure in the Medicare system, maybe not so much in NDIS, in the Medicare system to be very systems focused. The structure of the system is, literally anatomical systems based, because that was the thinking that was around in the 80s and before. And so I think the ability for people to take a holistic approach is extremely time consuming and very difficult. I know that a lot of GPs are spending a lot of time trying to take a holistic approach and finding it very challenging just to get enough in 6 minutes to get a holistic
I
approach.
don't know how to do it.
Yeah, I think
Yeah.
it
It's a lot.
appears, I would think that would be really difficult, but as you say, it's well worth it if you can get an opportunity. Just look at the time. Okay, any more questions? Got any questions? Any questions online if you can hear me? Don't know if Grant or not. I think that was a no. Well, I'll let you off the hook. Thank you for indulging me in the grilling. And thanks for sharing your ideas. It sounds like you've worked incredibly hard to come to these conclusions, and I wish you great luck in trying to communicate them more widely.
That's the harder aspect of it.
Yeah, but I think also you're trying to describe something that's a feel. I mean, I certainly, I was reflecting doing the Dupotrons release. The way I release the Dupotrons, I don't think I could teach it because I do it by feel, and I don't do it by. I do it by sight, but I do it mostly by feel, and I don't know that I could communicate that safely.
No, yeah.
So I can sort of understand. It sounds like you've got a fairly tactile approach to what you're doing, and being able to convert something that's kinetic into something that's
It's
oral.
definitely teachable.
Yeah.
But it's a lot to teach.
Yeah.
Yeah.
But that's okay.
Yeah.
That doesn't mean it's impossible.
No.
Mm. Thank you.
Thank you.
You're